In this training video, James, a 17-year-old male, is a patient being seen for his annual physical. James completed several screening tools prior to his physical, which indicated a history of alcohol use and risky behavior. Based on the screening tool responses, a healthcare professional will review the results with James.
James, all right.
Hello.
So, I'm just going to follow up with some of the paperwork that we finished earlier. Your exam and everything was good. So, we have a new protocol that we're doing where we ask patients a little bit about their drinking and some of the substances they use. So, that was that paperwork you filled out for me earlier.
Yep.
So, we're going to go over that right now if that's okay.
Okay.
All right. So, the first question asks about alcohol, and it asks you drink any alcohol more than a few sips, and you said yes. So, tell me a little bit about that.
So usually I'll normally go, when we go to a party, when me and my friends go to parties, normally we go to parties on weekends.
Okay.
I'll normally drink probably about 2-3 cups.
Okay.
At each party.
Okay. So 2-3 cups, are we talking the big red cups? Are we talking little tiny cups?
The small plastic styrofoam ones.
Okay, so the small, so that's probably about an 8 ounce. And then what are you drinking?
It depends on what's there. Normally, sometimes it'll be Hennessy, it'll be Crown Royal.
Okay. So typically
hard brown liquor.
Wow. Okay. So y'all like the hard brown liquor. I just got to write this for myself. So hard brown liquor is typically. And you said 2 to 3 cups. So are we more towards 3 or are we more towards 2?
2.5.
Okay. So
roughly 2.5.
About right in the middle.
Mm-hmm.
All right. So you said no to smoking any marijuana or any other drugs.
Mm-hmm.
All right. And then the question down here, it says, have you ever ridden in a car with someone, driven by someone, including yourself, who was high or had used alcohol or drugs? And you said yes.
Yeah, so I've ridden in a car with someone who has been drinking solely because I didn't have any money or anything to be able to take the bus or take a fare or Uber back home. Okay. And I didn't feel like walking those 30 minutes back to the house.
All right. So you knew they had been drinking, but just because of the timing, you were like, you didn't have the money to get back home. Okay. All right. And then it says, have you ever used drugs to relax or feel better about yourself or to fit in? So which one does that fall into the category for you?
So for me, it'll be to be able to fit in with my classmates.
Okay. All right. So do you ever feel like you have trouble fitting in any other time, or?
So normally when I'm in school, when we're in school, I keep to myself. Okay. So normally I'm really on the focus, stay on the study track.
Okay. All right.
So I really I don't socialize or communicate with anybody outside of school.
Okay.
But normally when we go to parties or any other functions like that, that's when I be able to take the chance to open myself up and be able to drink and open myself up to communicating with my other classmates to be able to get them know them better, be able to hang out with them more.
All right. And as you said, know that you don't drink alone. It hasn't caused you to forget things. Nobody's ever told you needed to cut down or quit, right? Mm-hmm. And then, but you have gotten in trouble. So tell me what the trouble is.
So normally the Monday morning when I get ready to go to school, sometimes I'm late because I done caught a major hangover from the night over. Okay. And mom she'll try to wake me up for that morning alarm, and I don't wake up, and then she'll catch an attitude, so she'll get mad, and I get in trouble with mom.
Okay. So. All right. How often is something like that happening?
It doesn't happen often. It just happens. I probably say once a month. Okay. And probably not even that.
Okay. So at least once a month. You're having where you're kind of dragging to get yourself out of bed and get ready for school, to where mom has to really kick up her momness to get
me out of school.
Okay.
Yeah.
All right. And have you ever had it where you actually have missed it, or?
So I missed school only one time, and that was only because my mom she was out of town. She had to go off on a training.
Okay. All right. So that one day when the mom wasn't there.
Yeah, I missed school, and that was I'm not doing that again.
Okay. So do you know any information about how much someone your age should actually drink?
No.
Okay. Is it okay if I give you a little bit of information? Mm-hmm. So the first thing is that for somebody your age, we actually suggest no alcohol. Okay. And one of the reasons why is that we know that the earlier you start to use any type of substance, whether it's alcohol, marijuana, that it actually can create a need in your body that you're going to actually end up developing over a longer period of time. The other thing is the younger that you drink, it actually starts to affect your organs. So your liver, your heart, your kidneys actually are affected by the alcohol that you're drinking. And especially if you're drinking If you're saying you're drinking those white cups, that's 8 ounces. And so even if you were older, that would actually be equal to about 3 or 4 drinks of hard liquor. And we know that long term that can cause a lot of damage. Are you noticing any physical problems? Any problems after you drink? You said you kind of sluggish hangover, but anything physically?
No physical problems, no physical issues. It's just when I wake up in the morning, I get like really bad migraines to the point where I'm super sensitive to light, movement.
Okay. All right. So it is at least causing some type of so it's affecting your brain basically.
So I'd say when I get it then it doesn't last long. Okay. It'll probably last like maybe an hour. But just in that hour between me waking up and getting ready to go to school, that hour is horrible. Okay.
All right. So let's think about this. So what do you like about the drinking?
So, for me, I love the taste of drinking because I like the taste of the alcohols that I do drink. Okay. Because it's for some alcohols that I do drink, it's sweet. For some alcohols I do drink, it's bitter. Okay. But majority of the alcohol that I drink is sweet, and it tastes good. Okay. So it tastes good, and you told me a little bit earlier, it helps you to be more social with your friends. Yeah. Because during that week you're really focused on school and being a good student. So this is kind of if I'm just making sure I got this correct, this is kind of your unwind. So you can drink the alcohol, you can unwind, you're able to relax with your friends and feel like you can converse and fit in when that's a lot different than how you are during the rest of the week. Right. Okay. So what are the bad sides? Bad sides really for me is really only the major migraines, the sway, and it's just hard for me to get up in the morning.
Okay. So it's hard to get up. But I think one of the things that you talked about, too, is the mom, right?
Yeah. Okay. Can't forget about the troubles with mom when I don't wake up in the morning.
Okay. So the other thing that you answered for me was thinking about change. And so you answered that you were at a 4, which means you're about 40% ready to change. So my question is why aren't you 1 or a 2?
Reason why I chose a 4 rather than a 1 or a 2 is because normally when I wake up in the morning during the week because I don't drink during the week. When I wake up in the morning, I'm fine and everything. But that Monday it seems like when I wake up right after I come from a party, I get them real horrible headaches, and to me I feel like it affects the beginning of my day. Okay. To where I'm more sluggish going into class. I'm more sluggish. I'm not as attentive as I want to be going into class with my studies and all of those other things. Okay. And sometimes I'll forget to grab assignments, or I'll forget certain assignments that I did that we were supposed to do or supposed to turn in the first or second period.
Okay. So it's affecting the point that sometimes you're just trying to deal with the headache, and then you end up leaving something that you normally would have had to have with you. Okay. Well, that's I can see that. All right, so why not a 6 or a 7?
Because I still like the taste of the alcohol. Okay. So I'm kind of caught in the middle of both. I'm in the middle of the best of both worlds. Okay. It's still a negative side, but I kind of don't want to get rid of it because it's still enjoyable. Okay.
All right. So if you think about just based on the information I gave you about the physicals, making some of those connections, do you feel like that you're at a point that you could make some type of change as far as how much you're drinking?
Mm-hmm. Okay. So for me, I think I'll be able to cut back that way, and what I want to try to do is I want to try to be able to cut back and see if that from that 2.5 cut back into a 1 to see if that will be able to cut back or at least get rid of those horrible migraines that I get in the mornings. Okay.
Have you ever tried to cut back before, in the last couple?
Okay. I haven't really been getting those horrible bad migraines until just recently, probably within the past 6 months.
Okay. How long have you been drinking like this?
Not long, probably about a year.
Okay. All right. So you've noticed as you've increased your drinking that the headaches come. So you feel like going back to maybe 1 drink where you weren't getting the headaches
will probably reduce the bad side effects I think I've been getting.
But then you still get to have the enjoyable part. You still get that. Okay. All right. That sounds good. My only other question or concern is the fact that you got into the car with somebody who you knew had been drinking. So I guess my question is, what kind of plan do you feel like that we can make to address that?
That's a good question. I think I need to just make sure I keep money in my pocket.
Okay.
Because just as a just in case measure.
Okay.
That way, when I do come from a party, and if one of my friends have been drinking, I can make sure I can have at least a little bit of money in my pocket. That way, I can be able to say no. You know what? Let me go ahead. I ride the bus. That way, I can at least make sure my safety is guaranteed.
Okay. All right. So at this point, what we're agreeing to is that you're going to try to cut back to at least one drink. And just kind of see, again, just see how you feel. See if that helps the migraines go away, and see if you still enjoy the party that you always have.
Yes.
And then the other thing is that we're going to have some money in our pockets so that if it does come up that one of the friends that you came with or the person you came with is, been drinking or using drugs, that you have another way to get home that can be safe for you.
Yes.
Okay. All right. So what we're going to do is I want you to try this for a couple of weeks, and then I'm going to have you come back and see me and just kind of see where you're able to do it. And then if not, we can just see what's the next steps and see the way that we can help you. Our goal is just for you to be healthy and safe. That's really what we want for you.
Okay.
All right. Well, thank you so much. I really appreciate you filling out the form, and I really appreciate you being honest with me.
Thank you so much.
Thank you.